everyone can hear me just fine.
Yes, we can, Ms. Muller. Go ahead.
Great. Sorry. Good evening, everyone. Sorry for the late start. We're just working out some technical difficulties, as Director Griffith said. My name is Kiva Muller, Communications Manager here at the Virgin Islands Housing Finance Authority. Tonight, much like 3 nights before, we are here to talk about the Community Development Block Grant Mitigation. It's an allocation of $774 million that we got for mitigation activities in the territory. And we will have a presentation for you this evening, and then we will allow question and answers and just a discussion about different things that are eligible under this grant program. So I will ask our Executive Director, Daryl Griffith, to give some opening remarks.
Hi, good evening, everyone. Thank you for your patience in us getting through the technical difficulties to get started. And tonight is really the VIHFA, along with our contractors, Tetra Tech. We're in a listening mode. We're simply here to hear the ideas of the community and to take those ideas and put it through the funnel of the Federal Register notice for the Community Development Block Grant Mitigation, which, as Kiva mentioned, is $774 million. And from all of these ideas that we've been listening through for the couple of months, we're going to take that and create an action plan. And from that action plan, we're also going to come back to you again and let the community give input into the different programs and projects that this $774 million will be able to cover. And we'll do all of this, and then we'll send all of this to HUD. So I want to thank you guys for logging in today. I want to thank you for taking time out of your busy schedules. On the panel today, we're going to have Mr. David Martin, who's our Chief Disaster Recovery Officer, who's overseeing both the Community Development Block Grant Disaster Recovery and also the Community Development Block Grant Mitigation. We also have Ms. Antoinette Fleming, who is the Director of CDBG-DR, and we have our Tetra Tech team, Mr. Neil Ratcliffe and Andrew Thurley, who will be communicating with you guys tonight. So thank you. I'm going to turn it back over to Kiva, and I hope you're full of questions and that this will be helpful for all of you with the ideas that you have to bring to the table. Thank you. Ms. Muller, you're on mute.
Sorry. Okay, so the goals for today's public hearing, like Director Griffith said, we just want to hear from you. So we're here to gather feedback on opinions and perceptions of the residents regarding what should be high priority items in our mitigation action plan. We want to identify potential project types that will help save lives and reduce the future losses to homes, businesses, and critical facilities. And then we want to spread the word about the online survey. We want to encourage you guys to participate in, well, this is the last public hearing before the action plan is drafted, but we still have some time to submit any questions, comments, or concerns to our email. That's mitigation@vihfa.gov, mitigation@vihfa.gov. And then at the end of this meeting, you'll have an opportunity to ask questions, or you can enter them in the chat room as we go along. Next slide. May I please have the next slide?
We may have lost Andrew's connection for a moment, but the next slide, Kiva, is the public input process.
Yeah.
You have it in front of you, or I can read it either way.
I have it in front of me. So the public input process, guys. So there's many ways that you can submit feedback. Like I said earlier, we'll have after the presentation, we'll have just a few minutes, 4 minutes per person. You guys can provide oral feedback, ask questions, just give your ideas or prospective projects that you'd like to see happen under mitigation. And we're gonna allow that at the end of this presentation. Also, please utilize the chat feature. We're already going in there. So feel free to use it. When question and answer segment comes up, I will be sure to ask the questions aloud so we can all answer them. And those that are listening via the radio station can hear as well. So we're gonna try to keep it as oral as possible because there are some people that are listening in and cannot see the presentation. So we're gonna try to make it as colorful as possible. If you have not yet, please, 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 I beg you to take the mitigation survey. It's on our VIHFA.gov website. As soon as the website pops up, there's a dialog box that comes on the screen, and it's the first item there. It's a really simple, maybe 2-minute survey. And then if you have more to say, more to ask, more to learn about, feel free to email us at mitigation@vihfa.gov. So that's mitigation@vihfa.gov. And I will hand it over to our Chief Disaster Recovery Officer, Mr. Dave Martin, to continue on mitigation funding.
Thank you, Kiva, and good evening, everyone. I want to spend just a few minutes talking about funding and the timeline for the action plan submittal. I'll also speak a little bit about HUD goals, and finally, I'll talk about the implementation and spending timeline. The process starts with the Federal Register notice, and what is that? The Federal Register is the official journal of the federal government. It's published every weekday except on holidays. It contains agency rules, proposal rules, and public notices, one of which was that the territory got allocated $774,188,000 for mitigation due to Hurricanes Maria and Irma. And then in terms of the action plan, HUD wants to provide the territory with adequate time to address citizen participation and other regulatory requirements. We have a due date of October 6, 2020 to complete our action plan, and then highlighted with the asterisk at the bottom, there are extensions obviously due to the COVID-19 pandemic, which will allow us to do our action plan through January 6, 2021. Sorry, I'm looking at my own slides as well. The total US VI, CDBG-DR, and MIT allocations generally are expressed in tranches, which themselves are funding allocations released by HUD. And today we are focused on tranche 3 for the CDBG-MIT tranche 3, which is the same number I provided a few seconds ago. Gonna jump to the next slide. And a definition. Rather than read it, let me just tell you what it says. The funds are intended for the territory to carry out strategic and high impact activities to mitigate disaster risk and reduce future losses. As far as HUD's goals, the first one essentially is saying focus on territory assets and resources where there has been repetitive loss of property and critical infrastructure, and then support that by rigorous data analysis to guide the investment decisions. Build capacity to comprehensively analyze disaster risk, and do it as a consortium and be thorough. The Tetra Tech-led team tonight is all about bringing all the territory stakeholders into a planning effort. We will support all that we do by the adoption of policies that reflect local and regional priorities, and also focus on community risk reduction. And the final 3 goals are: 1, maximize the impact of funds, encourage leveraging of private and public partnerships, and then coordinate with other federal agencies. And finally, the spending timeline. It's a long one. 50% of the funds expended in 6 years, and then the program completes in 12. I would now like to pass the next part of the presentation to my colleague, Antoinette Fleming.
Good evening, everyone. I will go through a few slides with you to discuss the CDBG-MIT requirements. Next slide. The MIT activities requirements involves about 4 steps, and I'm going to go through them. First one you heard already is meet the definition of a mitigation activity. The second one is we need to address the current and future risks identified in the mitigation need assessment, which is currently going on right now. The third one is the CDBG eligibility activities under the Title I, HCDA, which stands for the Housing and Community Development Act, or eligible activities pursuant to a waiver or an alternate requirement. So any activity that we fund must meet an eligible CDBG, basic CDBG eligibility requirement. The fourth requirement is it must meet a HUD national objective. You will hear a lot more about these things as we go through our presentation. So the mitigation needs assessment. It's a risk-based assessment that will inform the use of the CDBG-MIT funds. It's based on the mitigation needs assessment. It considers identified future and current disaster risk. Now, VIHFA is currently in this process of, talking to our consultants with other jurisdictions and private sectors, other government agencies. We are also trying to talk to nonprofits and for-profit entities. We also use the most recent risk assessment through the FEMA Hazard Mitigation Plan process to inform the use of how we will implement the CDBG-MIT funds. And we also use the risk identified in the FEMA-approved Hazard Mitigation Plan as a basic starting point for us to go forward. So the mitigation needs assessment, this is something that's going to be very critical to our conversation today. There are 7 critical service areas, or community lifelines as we call them. As I said, you'll hear more about them, but the 7 identified service areas are safety and security, food, water and shelter, health and medical, energy, communication, transportation, and hazardous material. As you listen to the critical service areas description later on in the presentation, I would like for you to think about how that service area has impacted our recovery efforts. What did not work during the hurricane or after the hurricane, and how can we as a territory make ourselves better and more resilient going forward? Next slide. All right. So the CDBG-MIT, as usual, we have to follow HUD national objectives. All MIT-funded activities must also demonstrate the ability to operate for the useful life of the project and include a plan for the long-term operation of the maintenance or the infrastructure or a public facility. We must be consistent with other mitigation activities that we will be carrying out in the territory. The national objectives that we will be following are 2 basic ones. You may hear an acronym called LMI, and that's the low to moderate income national objective. This national objective describes that the project is benefiting a vulnerable lower income group of individuals or a community, must benefit at least 50% of low to moderate income persons. The next national objective that an activity can be funded under is urgent need. Now, urgent need project addresses the current and future risks identified in the mitigation needs assessment, results in a measurable and verifiable reduction in risk of loss of life or even property. Next slide. Eligible mitigation program types. We can fund activities that are in infrastructure, public facilities. We can fund activities that are housing related, hardening of our existing housing structure, housing stock. We can fund activities that benefit the territory through an economic development activity, or even a planning activity or a public service activity. Covered projects, and infrastructure projects having a total project cost of $50 million or more, with at least 25 million of that of the 50 million of CDBG funds, regardless of the source. And a covered project have an additional requirement included in the development of the benefit cost analysis. So once a project has a total value of over $50 million or more, there's a substantial amount of work, additional work that the program needs to do to comply with HUD regulations. So at this point, what I'm going to do is turn the conversation to introduce to you Mr. Neil Radcliffe, and he's going to go through the CDBG-MIT eligibility activities.
Good evening, everybody. It's great to be with you, and it's always a pleasure to work with the wonderful people that are running the Virgin Islands Housing Finance Authority. They've been great partners with us. So I'm going to talk a little bit about, go into a little bit more detail regarding the kinds of projects that we are able to do and what type of analysis goes into whether or not a project is eligible. So some of the different considerations we looked at are depicted on this slide. One of the first things that we look at is, does the project benefit a low to moderate income population? We also look at, because these are mitigation funds, what specific kind of hazard will the project mitigate, and how will it mitigate against it, right? So sometimes people feel like, oh, we can use these CDBG dollars for just any kind of infrastructure or public works kind of project, but there has to be a nexus between reducing the possibility of damage to property and the threat to human life from future disasters. So there has to be a very strong mitigation tie. There are certain lifelines that have been identified by FEMA in particular that are important in doing the analysis of whether a particular project is the highest and best use of the dollars that we've got or not. This benefit cost analysis is as Antoinette mentioned, those projects that are covered projects, which are $50 million or more, are considered ones where you have to go through another layer of analysis, which is a pretty complex process that FEMA has you go through to determine if a particular project is going to be cost effective. And so that's one that specific FEMA cost benefit analysis doesn't have to be undertaken for every one of these projects unless they're a large covered project. We also look at whichever entity, whether it's a department of the territorial government or it's for-profit or non-profit folks out in the private sector, do they have the actual capacity to implement the project that they desire to undertake? And then we look at sustainability. Will there be more funding that's needed to help this project along over time? Do you have the operation and maintenance costs figured out so that we don't put hundreds of millions of dollars into projects that 10 years from now are falling apart? So those are some of the primary considerations. If we could go to the next slide, please. This is a diagram that simply depicts what kind of analysis we look at in terms of risk and impacts to given assets. So, there are different kinds of hazards that can impact the United States Virgin Islands, and we have different kinds of community assets, whether it's the most important of those obviously is the population, is our people, and then there's buildings and infrastructure and the natural environment and the economy. So we're trying to figure out, when you kind of cut through all of the complex red tape and bureaucracy of this program, we're really simply trying to figure out how to spend the dollars that have been allocated by the federal government on the very best projects that will provide the most benefit to the most people in the United States Virgin Islands. Next slide, please. Examples of kinds of eligible mitigation projects are, there are lots of different infrastructure and public facilities projects that can be done. And there are planning and public services opportunities that are, you can use some of the funding that has been allocated to us to upgrade your local codes and planning regulations, and to do education and outreach. Housing is, of course, one of the primary elements of this mitigation project. And some jurisdictions decide, say, hey, we're going to use all our CDBG money to do a buyout program so that people who have homes that are repetitively flooded can get out of those homes. That's a very example of a very narrow way to look at this. Most groups, cities, communities that have these kinds of funds look at a more holistic program and look at all of these different areas, the last of which is economic development. So particularly at a time when the cruise ship industry has been so heavily negatively impacted by the coronavirus, it may be wise to spend some of this money on economic development projects that help people to be able to make a living so that they don't wind up becoming homeless or become vulnerable in other ways. Next slide. Some of the things that are ineligible expressly are, one, buildings used for the general conduct of government. That means essentially, the federal government is granting us this money and they don't want the Virgin Islands to use that to build a new building for the legislature, right? Or you can't build a city hall with these funds. Now, it may be possible to build facilities for the city if they haven't been budgeted already, that might, for example, provide the police department a better facility to be able to operate from and to enable them to protect life and safe and health and property when a disaster comes. But that one gets a little bit more technical. Generally, emergency response services are not eligible. Private utilities generally are ineligible. And electric power grid projects, at this point, while there has been money allocated to the Virgin Islands for helping with the electric power grid, HUD has not yet released the technical rules that allow us to know how and in what manner those dollars can be spent. So they have said for the time being that we have to hold off on those. Next slide, please. I mentioned lifelines that HUD has identified that are important systems and elements of our community that we're focused on. I won't go through all the detail on these slides, but we'll move through them quickly. One of the lifelines is looking at safety and security and finding ways to enhance that. Next slide. Communications, as we all know, is incredibly important, especially when a disaster strikes. So there could be many things that would be beneficial to do to improve our communication system. Next slide. Food, water, and sheltering. We've heard of folks who have proposals to provide more sustainability and independence and self-reliance in the Virgin Islands in terms of food production. Ideas to provide more clean water to more people on the island and better and safer homes. Okay, next slide, please. Transportation, roads, highways, etc., is of course very important at any time, but particularly during a natural disaster. And there are lots of different projects that can be eligible for improving the mobility on the island. Next slide. Health and medical, you know, we need to have adequate health and medical facilities. And if those that are on the island or islands rather are not adequate, then that may be something that would be wise to look at in terms of funding. Next slide. Hazardous material management. Obviously, none of us want hazardous materials sloshing around and contaminating our lands, you know, people's yards, homes, public spaces. So this is something that can be addressed with these funds as well. Next slide. Energy can be addressed, as we discussed a few minutes ago, but there are some constraints given the lack of specific regulatory guidance from the federal government that we're still awaiting. Next slide. This is the action plan timeline, and you can see how this process began when Congress appropriated about $28 billion in funding of CDBG, disaster recovery and mitigation funding. A Federal Register notice was published on September 10th of 2019 to give everybody who received some of that money the rules that they needed to move forward. We can go to the next slide, please. Thanks. No, the one before that. All right, and then we began stakeholder outreach and meaning that we're just trying to glean from the individuals in the community what they think is most important for the use of this money, right? And so we're in the midst of that process. We're in the midst of developing the mitigation needs assessment. Essentially, with that mitigation needs assessment, the federal government wants to make sure that when we look at projects to do, that we don't do so in a vacuum without examining the hazard mitigation plan that FEMA requires the islands to generate. And then we have our public input hearings. We are drafting the action plan, and then it will be translated into other languages, etc. We'll make it available for public comment for at least 45 days. And then we'll have more opportunity for the public to weigh in on that before it's actually submitted to HUD by October 6th of 2020. And with that, I will pass the baton back over to Kiva. Thanks, Kiva.
Thank you. Follow along with my paper here. Okay, so next slide. I'm just reiterating some information that I said earlier, but this is the third public hearing that we're conducting now. We did one in June, one in July, and this is the last one. So this is final meeting to receive feedback, input before we draft the action plan. After the action plan is drafted, we will come back with maybe one or two, maybe two more meetings to discuss that document. At that time, you will be able to give your input. So this is the time to get all of your feedback, your ideas in to the team. And after the action plan has been drafted, it will have a 45-day comment period, like Neil said, and you can provide all of the commentary there. And during that 45-day period, we'll also come back with the other two meetings. Next slide. Okay, so we have arrived. We feel free to submit your comments in the chat room or to the email mitigation@VIHFA. Hopefully when you guys were waiting for us to start in the 20 minutes before, you took the survey. The link is also in the chat room. Thank you, Brenna. And yeah, next slide, that's fine. So when we get ready to open up the microphones, state your name, what company or organization you're from. We have a 4-minute limit on comments. What time is it right now? I have 6:51. It seems as we have a lot of participants on the line. It's 61 total, and I would assume that a lot of you have questions, comments, concerns, or just feedback that you'd like to get in. So you could either type it in the chat function, and I will ask the questions aloud and allow a member of the team to answer, or well, you can raise your hand, use your raise your hand feature, and then we'll unmute you. So we're gonna get started on that. Yeah, so what I'll do now, because I did get a presentation from Department of Human Services Commissioner Brown. It's on the line. Let me know if you are ready, and I will pull up your presentation and we can start with you. So you can type it in the chat, raise your hand, and we'll unmute you. I'm gonna pull up the presentation now and then share my screen.
It looks like we have 2 raised hands, and Andrew, I believe you will need to unmute them. It doesn't look like I'm able to do that at the moment. Mr. Richard Bourne-Vanek is the first one.
So it's, okay, I think Richard, you're muted.
Yes, I'm trying to unmute now.
You're unmuted, I can hear you.
Good. Oh, great, excellent. Good afternoon. Richard Bourne-Vanek. I'm an attorney in private practice in St. Thomas, Virgin Islands. I want to compliment you on an excellent presentation program thus far this evening. My comments had to do with my perception that our action plan should focus in particular, pay attention to 2 particular areas. One is my perception that we have a need to enhance and encourage the development of comprehensive services, community shelters that can provide more than just open auditorium space, that can facilitate the provision of hot meals, shower facilities, etc. Historically, our shelters have been in public school auditoriums, which creates a large open space for cots and blankets, but meals have to be brought in, and there's limited, if any, availability for bathing, and which limits the attractiveness of the shelter over a period of time. I think our shelters need to have a comprehensive suite of services in that regard, and that to do so, they should contemplate perhaps people who might need to be there, individuals and families, for as much as 2 weeks in the aftermath of a serious storm. The other area that I would like to feel should be given emphasis is in the development of additional healthcare facilities and redundancies in healthcare facilities in our territory. Again, historically, we have had large centrally located hospital facilities, both of which have been damaged, typically in severe hurricane storm conditions. As a result, we don't have an immediate redundancy of healthcare facilities and I believe a nodal type approach that would have satellite facilities that would be able to provide services in the event of damage to those central facilities would be an important way to create resilience with our healthcare facilities for our population, particularly because of geographic dispersion. And I'm thinking of the ability to provide healthcare not just for storm-related injuries, although that is critical, such as broken bones and lacerations, but also for routine healthcare procedures, for example, maternity procedures or dialysis. we would, I think, be well served to encourage the use of some of these funds to enhance and harden facilities that would be dispersed, so that there would not be a central focus on the central facilities. We'd be able to have surgical procedures, we'd be able to have clinic facilities, et cetera, that would be able to step in immediately and not have to rely upon bringing in another round of trailers, et cetera, for a temporary basis. So those are the two areas that I thought would be worthy of particular concentration. Each of them address the lifelines that have been articulated, since enhancing community shelters does address the need for shelter, the shelter lifeline, the food, water, and shelter lifeline, and of course, enhanced healthcare facilities on a nodal basis that would diversify and decentralize our healthcare infrastructure, obviously addresses health and medicine, medical lifeline. So with that, I thank you, and I would offer the rest of the time for other participants who wish to contribute. Thank you.
Thank you, Richard. I will pull up Department of Human Services presentation. Commissioners, are you on the line? Are you able to respond?
Yes, good evening. Are you hearing me? This is Assistant Commissioner Mikkel Reimer-Brown.
I am hearing you.
And on the line, we have our Acting Commissioner, Carla Benjamin, as well. But I'll just be going through with the presentation.
Okay. Hold 1 second. I'm giving me an error message sharing my screen. One. Can you see the presentation, Commissioner?
No, ma'am, it's not viewable now. You might want to put it back to how you had it before. Take it out of full view.
Oh, you saw it before?
Yes.
Okay.
We can see it now.
Okay.
Commissioner Brown, the floor is yours.
Commissioner Brown, are you there? Zoom seemed to have. Griffith, can you hear me?
Yes, I can hear you.
We are
Yes,
hearing
I hear you.
Commissioner Brown or Commissioner Benjamin or Kimberly Causey Gomez. Are any of the three of you online right now?
Sharing my screen. Is there any messages? Are you hearing me? She says unmute me. Should be unmuted. Allowed to talk. Sorry about that. Are you there?
Yes, I'm here. Can you hear me now?
Yes, ma'am.
Okay, thank you. Yes, I'm Assistant Commissioner Mikal Rima Brown, and I'm here representing our Commissioner Kimberly Causey Gomez, who is out of the territory this week. And we just want to share for our Department of Human Services a project that we are certainly hoping will receive the consideration for hazard mitigation CDBG funding. You can go to the next slide. Our vision is for holistic, respectful, responsive care. We have currently two homes for the aged, one on St. Thomas, the Queen Louise Home for the Aged, and on St. Croix, we have the Herbert Grigg Home for the Aged. You can go to the next slide. And Human Services, we are known for being a public sector agency that empowers individuals and families to move toward wellness and self-sufficiency through a seamless delivery of social services. Next slide. And our vision for Herbert Grigg and Queen Louise skilled nursing facilities is to create facilities that match the government of the Virgin Islands' commitment to protect our elderly and most vulnerable through providing residents of the Virgin Islands with 2 state-of-the-art skilled nursing facilities that meet or exceed national standards for quality of care. Next slide. And so we are hoping that this will be accomplished through 2 centers, through 2 facilities that are certified by Centers for Medicare and Medicaid Services. So they will, as I said, be located, one on St. Croix, which would be the Herbert Grigg Home Skilled Nursing Facility, and the Queen Louise Skilled Nursing Facility. We want to strategically capitalize on the opportunity to capture and reinvest available federal funds in the U.S. Virgin Islands economy and our people. We want to create a responsive and respectful continuum of care not currently provided in the USVI for memory care for persons with Alzheimer's and other dementias, and end-of-life care for our senior citizens. We believe it's so important that our seniors who have worked so hard for us across their lifetime to have their golden years in a setting that really respects them and the work that they have done and the contributions to our community. We also want to use these 2 facilities to provide post-acute care or rehabilitation that's currently missing in USVI. When individuals go to the hospital, some individuals may have had a stroke or they may have had a serious accident, some trauma, and the skilled nursing facility gives us the ability to do a long-term care nursing home and also temporary or up to 100 days of care and rehab care for individuals who need a skilled nursing facility. Next slide. So on the Kings Hill complex on St. Croix, we will have the Herbert Grigg Home for the Aged facility. That's where it is now. And we propose developing an 80-bed facility comprised of 2 2-story resident wings with a typical floor holding 10 double occupancy resident rooms, joined together with a new 2-story connector filled with light. And also, we are proposing a future 3-story human services, and it will be a social services building with associated parking and renovations to serve individuals who are low to moderate income, not only our seniors in the nursing home, but our seniors who are ambulatory, who are out in the community, our children and families, our low income individuals, low to moderate income, who may be persons with all